a chance to be with you this morning. I'm grateful to everyone who's come out to invest their time in learning more about the candidates and the positions of those who are running to represent you in Washington, to take on the very real challenges that our state and our country faces. And I'm grateful for the opportunity. PPI and the State Chamber, Christiana Care, thank you for hosting this candidate forum this morning. And I'm sorry that my opponent has chosen to not be here. I think it's important for folks in Delaware to look very seriously at who's going to take on the challenges in Washington, because frankly, in the 9 months that I've been a candidate for the U.S. Senate, as I've gone up and down the state, as I've met with employers, with homeowners, with families, I hear that folks are angry, they're concerned, they feel like Washington's disconnected from them, is not solving their real problems, is not making the difference that they expect folks in Washington to fight to make. And I get the sense from the gestures that I'm insufficient. Oh, wow.
Well, and welcome, Chris. We're glad to have you with us.
Good morning.
We thought you were lip syncing there for a while.
Did you hear enough of the opening that I can just go from there? Thank you.
Yeah.
This is truly booming now. So, I'm grateful again for a chance to be with you and to lay out some of my ideas, both on healthcare and more broadly. I think the important distinction that I'll draw for you in my race for the United States Senate is I am the only candidate who presents to you as someone with experience working in the private sector and experience working with the private sector. And of all the things that are broken in Washington and all the concerns I hear from folks up and down this state, there's two in common everywhere. What are you going to do to get us back to work? What are you going to do to fix our economy and to fight for America again, to make us competitive, to restart manufacturing, to change in tax and trade policy, and to make sure that our kids have got a better future? And second, I hear over and over again, what are you going to do to bridge the partisan divide? How are you going to work across this increasingly sharp divide and try and find some sorts of solutions? Because Delawareans, I hear over and over again, are less interested in the endless partisan bickering and more interested in finding some solutions. I'm someone who, in my 8 years with the Gore-Tex Company, one of America's most innovative manufacturing companies, a major producer and inventor and developer of medical devices, and in 6 years as the county executive here in Newcastle County, has learned how to meet a bottom line, has learned how to support and nurture and encourage innovation, and has worked closely with the private sector, with the chamber, with many others, to find a bipartisan consensus solution to what have been the toughest economic times our county, our state, and our country has faced in more than 30 years. I think that's a record that you ought to be proud of, that I'm proud of, and that allows me to stand before you as a candidate for the U.S. Senate with the experience, the values, and the ideas to go to Washington and to tackle the very real problems facing us. If you go to my website, chriscoons.com, there's content, there's substance across a wide range of areas and issues. But today we're here to talk mostly about health care. I watched, obviously, from a distance, because I wasn't in Washington or a part of Congress, a very messy, undisciplined, in some ways unethical process unfold as landmark legislation was considered, debated, and ultimately passed. But today, moving forward, I look forward, if I'm chosen by you to be your next senator, to going to Washington and to working to fix and implement what I think is a landmark bill. Now, why would I support the Affordable Care Act? Well, because it ends discrimination based on pre-existing conditions. It extends coverage in ways that I think will help make our country healthier and make health care more sustainable. It deals with wellness by providing, for example, annual checkups for those who are Medicaid beneficiaries, by investing in community health centers, by increasing the number of physicians and nurses who are available in rural parts of this state and our country. It also fixes the donut hole, extends coverage to those who are up to age 26, and ends lifetime caps. I think these are all important advances. And as I look at what was a very complicated 2,300-page bill, I also look at who fought for it. The organizations that represent America's nurses, who I'm proud to have their endorsement, the folks that advocate for America's doctors, for America's seniors, for America's hospitals, all advocated for this bill. At the end of the day, as best I can tell, it was mostly the insurance industry that was largely against it. There are lots of difficulties in how it's going to be implemented. And one of my main concerns, I'll identify two concerns if I could. One, I've heard from lots of small business owners, friends of mine, who are just outraged, concerned at least, about the 990 implementation, about how this new requirement for small businesses to file forms every time they spend more than $600 is just overly burdensome. And I think that is something that ought to be amended and revised promptly to reduce a needless burden on lots and lots of businesses that, although it was scored as raising a lot of money, I think is not worth the effort and is unduly intrusive into the operation of thousands of small mom-and-pop businesses. Second, I'm very concerned about squelching innovation, both here in Delaware and around the country. America is making great advances in pharmaceuticals, in medical devices, and in treatments, and that both has the very real prospect of reducing the costs of healthcare long-term and in improving our quality of life, and it's also one of our greatest areas of export growth. If we're going to be competitive again, we have to be continuing to grow, and I think growth comes predominantly through innovation. So we have a very tough challenge going ahead. There's lots of details to how this bill will be implemented that haven't been worked out yet. And I think we need to find ways that we continue to compensate physicians in a way that allows our seniors access to the physician of their choice, that allows physicians to continue to be private business owners and practitioners independent of hospital systems. I'm sure that's very popular. And I also frankly think we need to continue to promote early education and wellness. As was mentioned, I've been here a few minutes in the debate before. Child nutrition, early detection, wellness and health outreach can have a huge impact on the total health cost of our system. There's also been, I think, strategic investments in electronic medical systems, electronic medical records, and in this bill is a 10-year commitment of $350 million to hit a target of reducing Medicare and Medicaid waste, fraud, and abuse by 50%. Both of those, I think, are admirable targets, things that are important, and if implemented in a way that doesn't unduly interfere with the doctor-patient relationship, can move us towards a more efficient, more effective healthcare system. So